My name is Andre Samuel. I'm an orthopedic spine surgeon at the Fondren Orthopedic Group. So I came to the Fondren Orthopedic Group because first I'm a native Houstonian and I did my high school and a lot of my training in Texas. And I've heard about the Fondren Group for some time. I know it's a group of very well trained academic orthopedic surgeons, and they provide a great style of orthopedic care to the city of Houston. So I think in residency I really enjoyed all of orthopedic surgery. I think I would have been happy, as a joint surgeon, as a foot and ankle surgeon, but spine surgery I think really drew me because it's a field that I think has a lot of room to grow. There's a lot of new technology right now coming into the field, and there are things that we know work well and there are things we don't really know and understand very well. So it's a good field for future investigation and research and academics within the field of surgery. So when I see a patient for the first time, surgery is usually the last thing that's on my mind. For patients who come to me with back pain, neck pain, weakness, or pain going down the arms and legs, most patients improve just with non-operative measures. This includes physical therapy, it can be injections, it can be oral medications. And for any patient, I think, seeing a spine surgeon or seeing anyone for back and neck issues, it's important that it be a long process. And over time, those patients who don't improve with non-operative or conservative measures, those are the ones who may be ideal candidates for surgery down the line. I think the best part about being an orthopedic surgeon and being a doctor in general is being able to take care of patients who live and come from every walk of life, who come to you with some kind of disability or some kind of ailment. And in orthopedics especially, you're able to take care of them and usually see very quick returns and very quick improvements in their state of being. And that, for a physician, for a surgeon, is very gratifying, I think.